Hi, my name is Jim Wallace. I'm the Okanogan County Public Health Officer. I'm a family physician with Family Health Centers and wanted to take a little bit of time to talk with folks in the county about the new vaccinations that are out for kids 5 to 11 years of age. The Pfizer vaccine's been studied now in children and has been approved and determined to be effective and safe for use in adults, adolescents, and now kids. So we know now that COVID is impacting our kids more than previous strains of the virus. I've been fielding a lot of questions from concerned parents, from school nurses, from school officials, from my own family members about the safety of the vaccine versus the complications that arise with COVID. COVID does affect kids, and it can affect kids in severe ways. We see kids get multi-organ inflammatory syndrome, where multiple organs of the body are impacted. That's rare, but it does result in hospitalization and is one of the most dangerous impacts that COVID has on kids. We also see long COVID in kids. So kids can have symptoms for longer than 2 weeks. The cough, the runny nose, the cold, headaches, just general lethargy can last over a month in kids. And we see it impair their ability to do well in school or continue in sports. We know in adults that you can experience several months of cognitive slowing or the mental fog, headaches and fatigue that go with long COVID. And we don't know yet how that impacts kids. Kids don't easily tell us they have brain fog, and it's hard to tell when kids are slowing down cognitively, and it usually manifests in behavioral problems or not acting like themselves. That can impair their development, their growth, their social interactions with their peers, and affect their school performance too. There's a lot we don't know about COVID in kids. That's another reason why I'm worried about our children getting COVID. I know that vaccine side effects are a concern for a number of families. They were a concern that I had early on. I did a lot of research, read original articles, and evaluated the safety and efficacy of the COVID vaccine for myself, for adults, as well as for adolescents and now for kids. I'm confident that it's a safe and effective vaccine. The most common side effects are feeling a little bit of an illness because your immune system is ramping up and it's building its immunity to combat the virus if it ever does infect the body. Those side effects are a low-grade fever, fatigue, nausea, even a cough, and runny nose, because the vaccine is doing its job to prime the immune system. More severe complications include anaphylaxis and severe allergic reactions, and even myocarditis, pericarditis. Many people have heard of those things. They're really scary, but they're very, very rare. Only 1 to 2 cases in 40,000 people have been reported in older age groups, and there is reason to believe that it's less likely for younger age groups to get myocarditis. And so we're not advising that that's a reason to forego vaccination for kids. The risks of multi-organ inflammatory syndrome in children are much higher than any risk of complication or adverse effect of the vaccine. So we're still seeing a high number of new cases of COVID in Okanogan County. Our 14-day case rate, or number of new cases per 100,000 people in the past 14 days, is hovering between 600 and 650. And it's slowly declining from a peak of about 1,300, but we're not moving down fast enough. And the level we're at is higher than the majority of places in the United States and the rest of Washington ever experienced during the Delta surge. So we've got a long way to go before we get back down to low levels. Because we have high transmission rates and high case rates in Okanogan County, there's all the more reason to protect our kids with the vaccine right now. I'm excited to get my 5-year-old son vaccinated this weekend. My 5-year-old son is excited to get vaccinated. He's had enough COVID tests because of exposure or because of symptoms that he's had, and we'll continue to get him tested when appropriate, but we're also excited to give him that added layer of protection. I worry about him getting COVID. I don't think he'll be hospitalized, but there is a small chance that he could become really sick if he gets COVID. I also want him to be able to stay in school. In the first month of school, he was quarantined for over half of the days school was in session, and he fell behind. He missed the first week of kindergarten, he missed the third week of kindergarten, and it took a while for him to catch up. He's doing well now, but I don't want him to have to miss more school. So the primary reason we're offering vaccines for kids is to protect them from getting sick, to protect them from the complications. But there's some bonus benefits. Keeping kids in school and keeping them from having to quarantine because they're less at risk for contracting COVID. And so they stay in school, even if they've been exposed in the classroom. The other benefit, and I feel this selfishly for myself, is that I've missed numerous days in work. I've had to cancel clinic or cancel hospital shifts because I've been at home with my kids as they've been quarantining. That impacts the place that I work. It impacts my paycheck. It impacts all the people that I work with. An added, I guess you would say, bonus benefit of getting our kids vaccinated is that not only do they stay in school, but we continue to do work that's important to the economic vitality of our community. If you have more questions about the vaccine, I encourage you to talk to your healthcare provider. Primary care providers exist throughout Okanogan County with family health centers, with Confluence, with Three Rivers Hospital, Mid-Valley Medical Group, North Valley Hospital. We've got some of the best doctors, nurse practitioners, physician assistants, and other healthcare personnel in Okanogan County that I see myself and I work alongside, and I've got the trust and confidence that they'll be able to give you the right information. So for more information about the vaccine, you can go to the Okanogan County COVID-19.org website, where there are links to more information, lists of dates and times of vaccination events.